frontbenchers. Monica Lennon, please.
Thank you, Presiding Officer. I thank the Minister for her statement. Scottish Labour welcomes additional investment in mental health services and a commitment to raise the bar further. We share the same ambition for Scotland to have world-class mental health services. When the Scottish Youth Parliament published its 2016 report, Mental Health, Our Generation's Epidemic, it was a chilling moment, and I'm proud that fighting for access for school-based counselling has been a Labour priority in recent years, and I'm grateful the Government is now committed to delivering this. It's not just in children and young people services that we need to see real change, and I pay tribute today to campaigners like Gillian Murray and Karen McKeown, who have lost loved ones to suicide. And because of people like them who've kept pressure on people like me on this Parliament, we are seeing real action being taken. But we have to keep listening to people like them, and we have to go further still. Because Gillian Murray is saying it's not just Tayside where there are problems, it's all over Scotland. That's why she's calling for an inquiry nationally. Karen McKeown has said she doesn't want sympathy, she wants action, and she still wants answers. And if we look at Dame Koya herself...
No, I'm afraid I need a question. You've gone over your minute.
In conclusion then, so Dame Coy has also reinforced there's still a lack of good data, so we need to fill these data gaps to complete our understanding. Does the Minister agree, and will she address these concerns? Is a full review of services something she's taken forward through some of the announcements that she's made today?
Minister.
I thank Monica Lennon for her question, and again I welcome the cross-party support for improving mental health services. I think this is something that should be done out with a party politic arena. As I alluded to in my statement, or as I mentioned in my statement, the Suicide Prevention Leadership Group will shortly be publishing their delivery plan. Now, there have been on that leadership group people personally affected by bereavement by suicide, and there has been a lot of input from people who have been affected by suicide. I know that Rose Fitzpatrick has met many families unfortunately affected by that, and we will be working towards, as I said in my statement, reducing the rates of suicide by a further 20%. I also agree with what Monica Lennon is saying, that certainly data is an issue that we have come up against. There's certainly Dame Denise has identified that as an issue there, and that's one of the work streams that she'll be looking at, is looking at developing better data. But it's also something that we'll be looking at right across mental health services. And again, the mental health group that I'll be chairing, I'm sure that's an issue that will come up there.
Thank you.